Dr. Schmidt, I believe, is here in person. Talk about, well, sort of what Scott opened there with communication one to the other.
Indeed. Good morning. Those are nice pictures, but if it's possible, if we could darken the screen. I do not have a PowerPoint for you, for what I hope is a good reason. When there's a PowerPoint up there, I find myself gazing off at the font and this and that, and turns out you can all read faster than we can talk. So usually you can get through a slide in about 1/10 of the time it takes us to go through. So I'd like to just speak to you about the topic you see listed. But I want to talk about that topic first. The title in its Effective Patient-Doctor Communication was not picked at random. It was not scheduled as effective communication. It wasn't scheduled as effective doctor-patient communication. Okay? Let me take a step back. When I work with our fellows, as all of us on the glaucoma service do every day, I say to them at the start of the year, I want you to learn one thing every day. There's all kinds of information coming at you. You're going to try to learn it all. You can't. If you learn one thing every day that you use for the rest of your career, you're going to be far better off than most people. I would argue to all of you that if you take home one or two things from this meeting that you really use, that's far better than trying to remember everything. So I will tell you, and I'm going to give you two things, not one, but the first thing I want you to take home with you is tell your doctor what you want. Or put differently, tell your doctor why you are there. Seems like kind of a silly, almost stupid question, but it turns out people come to see us for many reasons. It may be I'm worried about going blind from glaucoma. It may be my medicines give me side effects. It may be my vision is getting worse. It may be I don't know what, and I will tell you that we don't know until you tell us. Now, we can't always give you what you want. It may not be possible. What you want may not be realistic. It may not be something that we can deliver. We may not be the doctor for that. But unless we know why you are in the office sitting in front of us, we can't help you. And in fact, you could get the greatest possible care from the standpoint of glaucoma from your doctor and be very unhappy because they didn't address the issue that brought you there. So let's talk about how in the real world you can do this. Because, of course, your visit doesn't last an hour. It's not open-ended. You don't have that doctor for as long as you like. That's the world we live in. So strategies you can use to maximize your communication from you to us are, first of all, knowing yourself, knowing what's bothering you, paying attention to your medicines, knowing what medicines you're on. I wish I could tell you it's rare for someone to come in and not be able to know what medicines there are, but it's quite common. That might mean having a list of your medicines, and for that matter, your systemic medicines, so that you can tell us. The more information you can get us, the better. That means writing things down before you come in. It means using our ancillary staff to help gather that information in a way that we can process most, for lack of a better word, efficiently. If you tell the technician or the screener, these are the concerns I have, they're going to be pretty good about writing that down for us, and we can do our best to answer those questions. If you don't tell them, and you go through the entire visit, and at the end of the visit, when the doctor says, is there anything else, you then pull out the list that you have, it's going to be a very frustrating experience for both you and, I can guarantee, for your doctor. We want to answer your questions. We want to give you the information that you need and you want. But unless you maximize the strategies for doing that, we're not going to be able to do that. In that vein, you need to be honest with yourself about what you're going to tell us. It's very hard for us to ask in a non-judgmental way, are you taking your medicines? But we're not judging you. We just want to know, is your pressure up because the drops aren't working? Or is the pressure up because you're not taking the drops for perhaps very appropriate reasons? You're not hurting our feelings if you give us information that we may not like. That's information that we need to take care of you. The second thing that I'd like you to take away from this has to do with what we can and can't do for you, and that was alluded to by some of the other speakers. And to some degree, it applies to life in general, which is the mathematical definition of happiness. All right, are you all ready for this? And this applies to glaucoma care. It applies to this conference. It applies to your marriage. It applies to everything. The mathematical definition of happiness is expectations minus reality. Okay? Now, what do I mean by that? Let's talk about a patient I saw just yesterday. A gentleman who had lost one eye as a child, and in his only remaining eye, several months ago came in with a pressure of 50, well on his way to being totally blind. I did surgery on him a couple of months ago. Fortunately, he's done well, as most patients do. He comes in yesterday. I examine him. His vision is 20/30. His pressure is 11. The eye looks perfect. If I would show a picture of that eye at a glaucoma convention, everyone would say, oh, doesn't that look nice? I'm as happy as can be. This man was going blind, and now he's not going blind. He was really unhappy, okay? He was 20/20 before the surgery. It turns out that when your pressure is very high, your cornea is clear, your vision is often very, very sharp. One of the ways to tell that a cornea patient has very high pressure after a transplant is they come in and say, wow, my vision is great. But you hear that and you think, oh, no, the pressure's up. And in fact, my patient's vision was down because of the surgery I did. I wouldn't have done it differently. He was unhappy about that. I had not done a good enough job about letting him know what the reality of glaucoma surgery is, which is that sometimes what it takes to save you from going blind is to make your vision a little bit worse. I would hope I told him that, but we hear a lot of things before surgery, and clearly, if I didn't say it in a way that allowed him to hear it and put it away, you know the saying, if the student doesn't get it, it's the teacher's fault, okay? So his expectations were out of line with reality. It was my job to try to give him appropriate expectations, and in fact, after we talked about it, when he kind of reflected about it, in point of fact, he realized that he had the best possible outcome. But nonetheless, he came into the office unhappy, but I didn't find out he was unhappy until the very end because he didn't say, I don't like my vision. So I would just ask all of you to know yourself, know what's going on. The reason this talk is patient-doctor communication is that it starts with the patient communicating to the doctor. We can't treat you unless you walk in the door. We can't treat you unless you tell our technician what the problem is. We have an obligation as well, but you have an obligation to know what's going on, to take that degree of responsibility for your care, and then present us with your concerns. We certainly then have the responsibility of doing our best to address those concerns. And the way to address that may be, well, that's not related to your glaucoma, or I'm sorry, I can't do anything about that, this is why. But at a minimum, you'd have to have your concerns recognized and addressed, even if they're not rectified, for lack of a better word. So rather than overwhelm you with a lot of information, I would please ask you to take away those two things. One, tell us what you want, or however you put that, tell us what's going on. You know, it's on you to say, I'm fine, I'm just here for a checkup. But it's also on you to say, my vision's getting worse. I'm worried I'm losing vision. Or it's on you to say, this drop affects my quality of life to the point where I can't take it reliably. So that's number one. And number two, not just with glaucoma, with the rest of your life, remember the mathematical definition of happiness. Thank you all for coming. I'm happy to take questions. If there are any, it's a fairly global talk, but I'm happy to.
Have you made that presentation to the doctors?
I beg your pardon?
Have you made that presentation to the doctors?
I have. And, I meant to, at the start of this, introduce myself in that I've been a member of the glaucoma service for 25 years this spring, as it turns out, and I was a resident fellow at Wills. And first of all, 25 years ago, we wouldn't have had this conference. We didn't know enough. This is a positive step to have this evolution of patient involvement, and it parallels the evolution of patients getting more involved in their care. I have given this talk, and I think most thoughtful glaucoma doctors would not disagree with anything that I've said. I mean, we're all different. The other thing, for example, to know about your doctor, there's some doctors who do everything. And they'll prescribe your glasses, and they'll do this and that. I am very clear about saying to patients, when they ask about their glasses or their whatever, I literally will use the phrase, I don't do that. I do your glaucoma, not like I don't care about that, but I'm just letting you know that what I'm here to do is to tell you that you either are or are not in the process of going blind from glaucoma. That's all I spend my day thinking about. That's what wakes me up at night. That may not make me the right doctor for you. So I'm okay with, or it's important for me to say who I am, and I understand there are probably patients who say, well, I want to get glasses from you too, and then I'm not the best doctor for them, and I'm okay with them making that judgment. So you want to be on the same plane with your doctor about that, and style and all that.
Okay.
Could you just repeat that mathematical equation again, please?
Sorry. Yeah, the mathematical definition of happiness is reality minus expectations. So if your expectations are too great about this conference, the reality of the conference is what it is. It's going to be what it's going to be. If your expectations are that everybody here, gets a car like at Oprah, well, you're going to be unhappy with this conference. If your expectation is that you're not going to learn a single darn thing the whole conference, well, you'll be happy because you'll learn more than nothing. So you got to look at whether your expectations are appropriate. Thank you all.
Thank you.